You're listening to Healthcare Now Radio. Stand by for This Just In, the latest in healthcare innovation and technology trends with your HIT advisor, Justin Barnes.
Thank you for tuning in and welcome to This Just In. I'm your host, Justin Barnes. In these half-hour segments, I'll bring you the latest advancements in healthcare, strategy, innovation, and public policy. As always, we're broadcasting from the This Just In studios on the Business Radio X network, as well as the Healthcare Now radio network. For this episode, my 90th episode, we're going to speak to a good friend and industry colleague, Jeremy Pierotti, co-founder and CEO of Sansoro Health. Welcome to the show, Jeremy.
Thank you, Justin. Glad to be here.
Great to. I came across Sansoro and you about a year ago, a little over a year ago at the HIMSS conference. We were actually put across the table from each other at a dinner that Howard Bird, a good friend of both of ours, puts together every single year. He does this elaborate and illustrious, I should say, dinner on the Sunday before HIMSS where he brings together innovators and just entrepreneurs and investors and just a great suite of people. And I was fortunate enough to meet you. So how did you get to know Howard?
I got to know Howard. I was one of my business partners, one of my co-founders, had been to his Venture Plus forum at a previous HIMSS, and I called Howard to talk about potentially getting some legal services from him about a year and a half ago. And then a few weeks after that, he called me and he said, "You should really register for this Venture Plus forum and have Sansoro compete." And I said to Howard, "I don't think we meet the criteria." After he sent me the information, he said, "No, you meet the criteria. Don't worry." And so we had about 2 weeks before the Venture Plus forum, and we pulled together our materials, and we ended up winning it, which was unexpected to say the least.
Yep. No, you did a great job. I saw the presentation, and then I actually had you on my radio show after you won. So I'll give your acceptance speech per se.
That's right. We had to run like crazy to get from the conference room all down to the HIMSS floor, but that was fun. I hope I wasn't panting too much.
No, you're great. It was a great episode. So tell us a little bit about, we'll dive into Sansoro here in a moment, but tell us a little bit about you as an entrepreneur, but also where were you born, raised, and at college and all that good stuff?
Sure. I was born in Washington, D.C., actually, lived there for the first 9 years of my life, then moved to Madison, Wisconsin, with my mom and stepdad, and went to middle school and high school in Madison. Ended up going back east for college, graduated from Brown University, went to Washington, D.C. to work on Capitol Hill, worked in the personal office of a United States Senator from Wisconsin, ended up working on healthcare policy, and I thought healthcare seemed pretty interesting, and so went on from that into getting a Master of Healthcare Administration in Minnesota. I promised my new bride that we would only be in Minnesota for 2 years. That was 1996, and we're still here.
Wow. I did not realize that you had a health policy background. That's terrific, fascinating. I mean, that's obviously it was my world and still is for almost the last 15 years. So
yeah, I had no business doing what I was doing because I was 22 years old and sitting in the majority leaders conference room listening to these grizzled veterans talk about what was possible and not possible in terms of financing reform.
Yeah, no, that's a lot of Capitol Hill. I mean, it's a younger crowd in a lot of ways. A lot of the health LAs and just LAs in general tend to be younger, but they're brilliant and they're very smart, very hardworking, and just make it happen and make Congress tick. So I was strong.
You are right. The only way to learn anything more and more quickly is to start a company.
Yep. So true. So true. So talking about starting a company. How did you come to helping form Sansoro Health?
Well, I had gotten to meet another one of my co-founders, Dave Levin when we both worked on a big EMR implementation project in Florida as consultants. And Dave a few years later was the Chief Medical Information Officer at the Cleveland Clinic, and he called me and he said, hey, I met a couple of guys who have this really interesting idea, and he described the basis of Sansoro, which is a middleware platform that would provide real-time web services connectivity between third-party applications and the major electronic medical record platforms. The idea being, if we're going to innovate, we need free exchange of data in a secure manner, the way the rest of the digital economy works, the way online banking and retail and logistics works. And I told him I thought we could fundamentally change health IT if we could pull this off. So we started meeting, and over the course of several months, pulled the company together and launched toward the end of the summer of 2014.
That's excellent. That's a unique story, but certainly that's how a lot of companies just get formed. I mean, it's you make great people, you realize you can make a difference and you can solve problems. So let's dive in a little bit, because obviously I've had the pleasure to get to know you and your product. I understand your position in the market and very excited about it. And that's why I wanted to have you on the show today. But for my audience, tell us, what problem specifically are you solving?
Well, we solve a problem from two angles. So from the angle of the providers, the health systems, we help providers eliminate the friction of integrating innovative new applications into their ecosystems. We know that providers have invested millions, hundreds of millions, hundreds of billions of dollars in total into building a digital infrastructure. But that digital infrastructure requires an enormous amount of labor in order to share data from one health IT application to another. And so what our emissary application does is it makes it easy for a developer of a third-party application, whether it's a mobile application for physicians or whether it's an application that provides real-time analytics and clinical decision support, or whether it's an innovative patient portal. It allows them to quickly and easily integrate into the core electronic medical record platforms that health systems use, that all health systems use these days, whether it's Cerner or Meditech or Epic or Allscripts. We provide a universal command language that developers can write to, so that they don't have to write and connect one way to Epic and a different way to Cerner and a third way to Meditech. They just use our universal command language. Emissary translates into the format and transport protocols that are necessary for each one of those different EMRs.
So, and I love it. So, but there's a lot of people, there's obviously a crowded space. There's a lot of people attacking this problem, different perspectives, different technologies, different innovations. But what really differentiates Sansoro Health from the rest of the industry and your competitors?
Yeah, we've taken a technology approach that is unique in that we're not copying any data from the EMR. So when by the way we enable the free exchange of data is the data from and writing data to the production transactional database that users of the EMR are interacting with when they use the front-end applications of the EMR itself. So that presents a bunch of advantages. It means that you don't have an extra security target because you haven't created a whole copy of every patient's record. It means that you never have any latency issues because you're not dealing with a copy of data that may become out of sync. And it means that as a developer, you always know you've got data integrity because you're always interacting with the source system. For a provider, what it means, most importantly, it means I can, as a CIO or CMIO, I can get into the hands of my users, my physicians, my office staff, my back office staff, my nurses. I can get into their hands much more quickly the technology they need to do their jobs more efficiently so that ultimately we can all accomplish what we're after here, which is higher quality care at lower cost.
So who are some of your customers then? And I get it. So tell me, like, who would be an average customer? You can give us a name of a couple of your customers, but then also who would be future customers that you would look for that would be just a good fit from what you know needs to happen in their health system or their large practice and so forth.
Yeah. So we have two different licensing models. We have health systems that license our software on an enterprise basis so that it creates this layer over their EMR that makes it easy for them and practical for them to connect other applications. And so, for example, one of our customers is Tampa General Hospital in the heart of Tampa, Florida. In fact, we gave a presentation with the CMIO from Tampa General at HIMSS. It was an official HIMSS presentation and was standing room only. We were pretty excited.
Yeah.
And what Tampa General did was they had another EMR that they had to make visible within their primary EMR. And so rather than go through a complicated and expensive data conversion, they use our software to be a bridge. So a user is working in their primary EMR, which happens to be Epic, clicks a button, and the main part of that Epic screen dissolves, and up comes an external third-party web application. That web application uses our software to reach into the other EMR and bring back that patient's chart. So for the physician working with that patient in the office who wants to see all of that patient's medical history and information, it's great because she doesn't have to log out of Epic, log into another application, search for that patient, pull that patient's information up, compare back and forth. All she has to do now is click one button and that patient's information from the other EMR is visible right there, including 10 years of scanned images from the other EMR, which is almost unheard of. So that's a really exciting use case. We have a couple of other health systems that have deployed or are in the middle of deploying a similar solution. Having two EMRs in one or three or four EMRs in one is exciting to a lot of people, and it seems so simple because it's not like it's a complicated workflow. But if you're a physician and you've got a patient in your office, and your workflow would otherwise be, I have to call the HIM department and ask them to print out or fax up to me other records, or I have to log into a different EMR and go find that patient. If you're a primary care physician or a specialist, those minutes matter. So this improves productivity and leads to better outcomes because they've got all the information they need at their fingertips. So that's an example. And then Tampa General is also using our software to integrate other third-party software where otherwise data exchange just wasn't feasible. It wouldn't be economical. Now they just tell those vendors, hey, we've got an API layer, code your software to our API layer, and now you can get the real-time medication orders that you're looking for, or you can engage in real-time message exchange with users within our EMR. So it's exciting.
So tell me, what about a couple other, give us one more deployment in a different health system or with a vendor, because I think also you can work directly with EHR vendors, right? EHR companies?
We generally work directly with not the EHR vendors themselves, but with the other innovative health IT companies that otherwise would have to go through a 6 to 9 month process of creating new HL7 interfaces, creating new batch extracts. So another example is that we work very closely with a clinical analytics and clinical surveillance vendor.
That's right.
So they do great stuff. They provide dashboards to clinical staff that provide advance warning of patients who are coming down with sepsis. They provide dashboards to infection control units that provide a map and overview of use of antibiotics and that provide advance warning of when infection is spreading and allow them to intervene earlier than they otherwise would in the hospital. Of course, doing all of that requires a constant stream of data from the EMR, and their typical practice had been 6 to 9 months, sometimes 12 months worth of interface building. Now they go into a health system customer, for example, they've got a couple of customers on Cerner that are already using our software. They go into that health system customer, they drop in our software, they've already coded their analytics application to our software. And so instead of 6 to 9 months, that hospital is up and running with their users getting better analytics and decision support information in a month. So everybody wins. The clinical analytics vendor wins because they install faster at lower cost. Because they're using the software that's delivering better outcomes. And the patients win, obviously, because they get better care.
Yep. No, excellent. And for those just tuning in, we're speaking with Jeremy Pierotti, CEO of Sansoro Health. So give us a couple of examples of the information, the medical information that's being shared here.
Yeah, sure. We, to take another vendor customer of ours, we've got a customer that is pretty well known that has a great mobile application. It integrates both waveform data from EKGs and ECGs and fetal heart monitors, along with data from the electronic medical record. So they source the waveform data directly from the vendor, from the device vendor, and they source the EMR data through our software, Emissary. So what they're able to provide to the physician, no matter where that physician is, on her tablet or smartphone, they're able to provide labs and medication orders and medication administration history and allergies. So as the physician is looking at the waveform or just looking to get a summary of, hey, what's the update on this patient? The patient was admitted yesterday. I want to see how things are going. All of the clinical information from the EMR is available right there on the tablet in a really elegant user interface. So we can source almost any clinical information right from the EMR, and we're starting to source some revenue cycle information also, schedule information, that kind of thing.
Awesome. That's getting into more sides of my world. So talk a little bit about, you mentioned Epic, you mentioned Cerner, heard Meditech. Who are some of the companies? Because I guess the big thing, me coming, I've worked for almost all of them at this point, I feel, but I try to, you want interoperability between Greenway and Epic. You want interoperability between Athena and Greenway in some communities. You want Cerner and Meditech in some communities, and McKesson and Siemens in some communities, or now it's Cerner. So how does that work? And how could that work with you guys, and how long would it take to spin something like that up?
Yeah, so we right now, we started with building support for the largest of the acute care EMR vendors. Mm-hmm. And then so that was Cerner, Epic, Meditech, and then one of our customers asked us to build support for Allscripts TouchWorks, so we've done that. We're looking at and beginning to plan to build connectivity to some of the other acute care EMR systems, and we're also looking at some of the largest cloud-based EMR platforms, such as Athena Health and Greenway, and I think we'll be getting started on that in very short order. But what we are able to do is, because we can tap into the medical record discretely, and not just by sourcing the CCD, but hey, if you only want lab results from 2 years ago to a year ago for a particular patient, you can just get those. Or if you want lab results of just a particular test type over the last 10 years, you can get those, because essentially we provide a flexible query language that's standardized across all of the EMRs. So it makes it a much more efficient way of exchanging data. When you can be efficient about grabbing what you need, there's better security.
Yeah, so perfect. You're a great lead-in guy, because now my next thing is my security. So obviously, kind of on the top 3 topics in healthcare right now is data security. So how do you guys provide the security for the data that's being transmitted and that you're housing? And I heard you're actually not housing certain types of data. So tell me how that all works.
Yeah, that's right. So the first thing we do is we don't create copies of the data when it's not needed. So we always source it real time from the EMR itself. Secondly, every time a request for data is made, it carries credentials that are validated by the EMR itself. So if those credentials aren't valid, if that user account is suspended, then there's no way to get the data or to put the data into the EMR. And then we have encryption at both ends to make sure that the data is always encrypted in transit, and because it's never at rest really within our application, there's no encryption needed because there's no database. Finally, we provide an audit trail, an audit log, and our customers typically get that audit log in a format where they can ingest it right into their security surveillance systems so that they know exactly what user activity is going through our connection software, and it means that nobody has a way around, nobody can use our software to get around any security policies or procedures in the provider. So we've paid a lot of attention to it.
Cool.
One of my first jobs was working as a HIPAA program director for a big health system in Minnesota. So I'm acutely aware of the need for strong security measures.
Yeah. No, it sounds excellent. So let's take a step back now and pivot a little bit. You've had some big news lately. I think you took on an investment. So tell me, how did that, who would you partner with, and whatever you can announce publicly, and then also what's your future strategy around some of your investment and fundraising?
Yeah, sure. We couldn't be happier. We announced last week that Bain Capital Ventures had led our Series A, and Yuman Choi is the managing director at Bain Capital Ventures, who focuses on healthcare. And it was a fairly quick process for us. We started our Series A raise in early January, and we actually closed it on March 31. So that's great. And right now, our focus is on building the company, using the funding to strengthen our product development, to strengthen our go-to-market team, both on the sales team and the marketing team. And that's going to be our primary focus. We've got great technology, but I'm old enough to remember that VHS beat Betamax, even though Betamax was seen as the better video recorder technology. So we know that having a great go-to-market strategy is critical.
Yeah, no, I completely agree. You're very wise. So talking about wise, sage advice, because you have been around for a little while, and you've been through, you fought the fires and you've emerged through the fire. So what advice, would you give to other CEOs and senior executives? You've been building Sansoro Health now for a couple of years, but what advice would you give to some other people that listen to this phone? Because a lot of this show, because a lot of people, certainly entrepreneurs, listen to this show as well.
Yeah. So first of all, I've been so fortunate to get advice from anybody I've asked it from, you included, Justin. So I think what's great about the health IT innovator community is that co-founders and successful entrepreneurs are more than happy to share their experiences and wisdom with each other. So if you're starting a company, know that you're not alone. I'm always happy to share my experiences with others, and I certainly have benefited greatly from those who made progress before me. Secondly, we frequently talk about being a mission-driven company. That some have asked us, well, would you sell Sansoro to a company that was looking primarily to shut you down to protect their own economic model? And our answer was, is, and always will be absolutely not. Our goal is to improve care and reduce the cost of delivering that care by enabling innovation. And we talk about that with our team members every day. So being mission-driven helps you stay focused. And I guess thirdly, my advice would be, if you're looking to raise outside capital, understand that your investors want to make sure that you're creating a product or service that has some price protection, where they can be assured that it won't become commoditized. And so as you're thinking about your market strategy and your product strategy, think that through, because investors, for obvious reasons, don't want to invest in new companies or products that will quickly be copied by others, and therefore pricing will be significantly compromised.
Wow, no, you hit some really big points, my friend. That's excellent salient points and sage advice. You hit a lot of the things that we did at Greenway. That was my last big venture, and that was we were certainly a mission-driven company, and we sought advice and wisdom from everybody that we could, and we certainly had really strong IP, and we had a great attorney there. We actually worked with Howard Bird as well when he was with Blank Rome, but also our in-house counsel, Bill Esslinger, was a great lawyer, and just we filed a lot of IP and IP protections, and we kept it, a very strong IP portfolio for that exact reason.
Absolutely.
Yeah. No,
Absolutely.
great advice. So in our closing 45 seconds or so, I always ask this of my guests, and now it's actually its own segment. My radio station has moshed all these together, but what is your favorite place to get or be inspired?
I love playing the violin. I've played since I was 9, and so when I have free moments or when I'm smart enough to carve out time, I take out my violin and I find playing the instrument inspiring, and I go to a lot of concerts because to me, sitting in whether it's a big concert hall or a small chamber music hall and listening to great music, whether it's from the old masters or whether it's contemporary compositions, it helps me relax and think about the bigger picture and refocus.
No, that's terrific, and I can tell it brings a calm demeanor across you, and I can hear it in your voice. So obviously it works very well.
Smile on my face too.
Exactly.
Yeah, thank you.
So Jeremy Pierotti, CEO and co-founder of Sansoro Health. Thank you so much, Jeremy, for joining the show. It's always a pleasure to talk to you and be able to collaborate with you, my friend.
Thank you, Justin. Really appreciate the time.
You got it. And thank you to everyone for listening. And thank you again. Join us weekdays, 2:30 p.m. Eastern, 11:30 a.m. Pacific. As always, you can track me on Twitter at HIT Advisor. You can use the hashtag #ThisJustIn so we can respond to your comments from the show. In addition, all my comments and material and content we posted at justinbarnes.com. Thanks, everyone, and have a terrific week.